and introducing you, Mark Johnson, to the second season of the Tillamook County Pioneer podcast. But we were just chatting about the history, or you were going to talk about the district, but if you could talk about the history within the community, I think that's usually what people are most interested in. So I kind of want to put that up front at the beginning.
Sure. Well, the Nehalem Bay Health District, headquartered in beautiful Wheeler, Oregon, is the smallest health district in Oregon. But I like to say we have the biggest plans. Small district, but big plans. You may recall we were successful with a bond measure back in May, thanks to really great support in the community, North Tillamook County, of that allows us to do several things we're working diligently to do. One is to construct a new health center and pharmacy building in Wheeler to replace the former Reinhardt Clinic, now the Nehalem Bay Health Center and Pharmacy. That will basically almost triple the size of the existing clinic building and provide us with lots of opportunity to do new and improved healthcare delivery in North Tillamook County. Same time, we're working to begin the renovation and modernization of the Nehalem Valley Care Center, a 50-bed skilled nursing facility, also in Wheeler. Really important facility. It's the only one of its kind between Astoria and Newport on the coast. Provides 24-hour, 365-day-a-year skilled nursing care to patients, as well as rehabilitation services for people who may have had, some surgery, hospitalized, and need some transition before they're able to get back into their own homes. And then third phase of the project would be to demolish the old Wheeler Hospital, which dates back to the early 50s and was a hospital until the early 80s. And our aspiration is to repurpose the land that the old hospital sits on and create some housing units, particularly geared toward providing housing alternatives for the about 80 people who are employed in healthcare in North Tillamook County. So big projects for a little health district, but we're moving on all cylinders.
That's pretty cool. Um, the clinic is an invaluable resource. I mean, in every community, the clinics are incredibly important, especially in communities with a, I would say aging population, not totally
Right.
elderly, but Wheeler and that part of the North Coast is there are a lot of people who are retired, and this is where they choose to spend out the last years of their life. And being able to care for those people is very important. How
Well,
many
it's very true. You look at the demographics of Tillamook County generally, and maybe more specifically the area north of, say, Bay City or Rockaway. It really is more and more an aging population, which is not to say that there aren't families and young people who are working in retail and agriculture and timber harvesting and all kinds of other jobs. But a lot of folks have chosen to live here in their retirement. And one of the needs that a lot of people find, of course, is that they need to access some regular health care. And without more options locally, more and more people are going to have to make a tough decision about where to get their health care, often having to travel long distances to do so. The other aspect of what we're trying to do, though, because this is a diverse community with older people who have chosen to live here in their retirement time, but also young families, working people. We're trying to provide a range of services and a range of options for those folks so that everyone in the community has a local healthcare option.
That's fantastic. About how many people are inside the district boundaries?
About a little over 4,000 within the boundaries of the health district, which is basically just north of Rockaway to the Clatsop County line, and then all the way to the Washington County line to the east. So a big chunk of geography, but not very many people. The population, of course, would be centered in Wheeler, Nehalem, and Manzanita and Neocani area.
Fantastic. What do you see as the biggest need within the community in terms of both healthcare, but also specifically the clinic? This obviously the new building is not going to be free.
Well, I think that the challenge is to create a range of services, supplement what we have traditionally been able to offer in the community with additional services that a new building will permit, a larger building, a modern building. The plans call for a dental suite, for example. No dental service in the community at the present time. We have aspirations to develop specialty care services, cardiology, pediatrics. The existing health center staff right now is doing some outreach in the community to ascertain what people are most interested in having available, and we're going to try to meet those needs as best we can. The new facility, because it will have more space to take care of more patients and also to facilitate the services of more healthcare providers, is really critical to being able to expand the range of things that are available in the community. So if we want better healthcare and more options, the health district board decided some time back that we were going to have to upgrade our facilities, and that's really exactly what we're trying to do right now.
Awesome. What's the biggest upgrade? Is it just the space and the size, or is it that the entire because the entire building's new, it can offer more specialized design for some of the newer technologies? What's going to be, what should people look for that's going to be the most exciting new feature?
Well, I think it's all of those things. It's an expanded facility with more opportunity, as I said a moment ago, to take care of more patients. So more exam rooms, a much larger pharmacy. The current pharmacy, in many respects, serves the community very, very well, but it's very small. And the new facility will have a much enlarged pharmacy. It'll be much more like a typical pharmacy that you might see in a larger location.
Wonderful.
The dental service capabilities will be entirely new to the community. And as I said, we're going to have a combination, I hope, of both the ability to offer some level of specialty care. And again, I mean by specialty care, you need to see a cardiologist, or a youngster needs to see a pediatrician, or maybe a gerontologist for an older adult. So we're going to have the opportunity to develop those kinds of services in a new building with enough space to accommodate those kinds of providers. And then, at the same time, we're going to have a much more attractive place for people to go to take advantage of the services that are there. We live in an area where a certain percentage of our population, unfortunately, is economically challenged. And those folks have every right to a nice place to get health care, just as any wealthy retiree might have someplace in Portland or Eugene. So we're really trying to upgrade the facility, both from a service standpoint, but also just as a place that people in the community are going to say, that's where I want to get my health care.
Beautiful. What about the building? I'm assuming it's already designed, or are you still in the processes of planning?
We're about 2/3 of the way through the design process. We just a couple of weeks ago appeared before the Wheeler Planning Commission with the design review package, which is basically the exterior finishings of the building, the parking array, how the landscaping will work, the access off of Highway 101 and Hospital Road in Wheeler. All of that was presented to the Planning Commission. About 10 days ago, they gave us a conditional approval because they wanted to see a little more detail on 3 or 4 specific things, but very enthusiastic about the design of the building. It'll be a 2-story, about 1,600 square foot facility with adequate parking to meet the city's requirements, adequate ADA parking.
Wait, can we stop there for a second? Did
Sure.
you say 1,600 square foot?
I'm sorry, 16,000 square feet.
Yeah,
I
I
beg
was
your
gonna
pardon.
say, wait a minute,
Yeah,
that's tiny.
16,000 square feet.
Okay,
Um,
that makes more sense.
and about a sizable parking lot because the requirements are to have adequate parking for staff as well as for patients. One of the things that I think is really going to be very attractive about the location is it's going to be much more visible in the community. The facility is much more visible in the community than the existing clinic, which is up on the hill, a little bit out of sight, out of mind for people. But anyone traveling on Highway 101 north or south is going to be, I think, I hope and I believe will be really impressed by this very handsome new facility with many nice amenities on the exterior of the building. It's going to be well landscaped. We're going to try to take into account the kind of unique location of the building between Nehalem Bay and kind of the upland forest that begins right at the back side of the building. And the landscaping has been, I think, very thoughtfully um, considered in that regard, and so that it really kind of serves as a transition between the kind of tidal marsh that happens along the bay and more mature stands of timber up a little higher above the river. So going to be on the easy access for people who are taking public transit to come to the health center or the pharmacy. So it's got all. I think the design and the location really have a lot going for it.
Wonderful. I agree. They don't have to climb that entire hill, especially during the icy winter. It's not that safe and it's dark. So this will be a lot easier for people, for most people to be able to get to. And then you don't have all of the hospital, well, it's not hospital, the clinic traffic in the neighborhoods. And I'm sure that is there a plan for the space where the clinic use is now? Is that going to turn into something, or is it going to still be some kind of facility?
Well, we're kind of considering options on that. It's obviously going to be a couple of years before that building is going to be vacant, and the clinic existing clinic located to the new health center. So we have some time to figure that out. The building, while too small and inadequate in some ways for continued healthcare services, is structurally sound. There's some life left in the building for sure. So we're definitely going to be looking at how we might repurpose the building to provide other community assets. So we're looking at that.
Wonderful. We just have a few minutes left, so I want to really focus in on if there is anything that you need the community to do. How can we all support you in this work?
Well, thanks for that. Number one, be engaged with us. Stay up to date if you possibly can on our plans. We're trying to be as out in the community as we possibly can be in terms of telling people about what we're trying to do and the time frame in which we're trying to do it. Um, we passed this bond measure with nearly 70% support in the community, which was a wonderful show of support from the community. Nearly 75% support in Wheeler, which is really gratifying. And I would be remiss if I didn't say to the folks at the city of Wheeler that we very much appreciate the diligence with which they've approached the project and the cooperative nature that they have displayed in working with us on the project. So that's very, very welcome. So I would just say, stay up to date. We're going to try to keep the information flowing on what we're doing. Um, we're going to have some opportunities for further community participation in the new year, I think, in a variety of different ways. And so stay tuned. It's going to be an
You know,
exciting time, I think.
I realized, I introduced you by name, but I don't believe you actually informed the audience of your title. So why don't we leave them with how you got involved with the health district and a little bit about you, just so that they can maybe connect more with your story as well.
Sure. Thank you. Well, I'm currently serving as the president of the Nehalem Bay Health District Board. It's a 5-person board, elected in the community. I have 4 great board member colleagues. Linda Chick, a registered nurse from Nehalem, is the vice president of our board. Debbie Moberly from Nehalem is the secretary treasurer. Jackie Hinton, who lives in Neahkani, in the Neahkani area, is another board member, a retired attorney. And the 5th board member is Anupam Narayan, who lives in Manzanita. Really interesting background as well. Anupam was CEO of Red Lion Hotels Company, spent much of his career before his retirement in the hospitality industry. Obviously, a great hand to have on your board when we're undertaking these construction and renovation projects. Debbie Moberly had a great career in her working in her pre-retirement working life as a working in the high tech industries, and she has done a terrific job of helping the district kind of grow into this new role of being a property developer because there's lots of intricacies involved in that. So we have a really terrific board. I got involved in about, I think, 2017 when I was appointed by the county commissioners to fill a vacancy on the board. And we undertook shortly thereafter a strategic planning process with the help of Portland State University's nonprofit center in order to kind of chart a strategic direction for the health district. And lo and behold, here we are 5 or 6 years later, actually implementing that plan, which called for updated and improved primary health care services in the community, an effort to improve senior care services, which is the skilled nursing facility, and a desire to try to find a way to impact in some way the shortage of good housing for working people in the community. So we're really trying to implement the plan on all 3 levels, and it's an exciting time to be involved.
That's a wonderful note to leave people on. Are there, so the district is funded through mostly property or bonds, as or both property
Yeah, we
taxes and
receive
bonds?
the district has historically, the district goes back to the early 50s when it was created, essentially at the time that the old Wheeler Hospital was built, um, and has been supported historically by a fairly modest annual levy, property tax levy. That's the operating levy for the district. We received some timber tax, which kind of fluctuates from year to year. And because of the taxpayer support for our initiatives to upgrade healthcare in the community, we had the proceeds of a bond election, which again is supported by property tax revenue. And so it's really property taxes, timber taxes, and to the extent we possibly can, and we are actively doing this right now, seeking support from foundations and private philanthropy in order to make sure we're able to do all that we aspire to do.
That's wonderful. And I know that not to highlight another amazing nonprofit, but the community college, didn't they just open a nursing program in Tillamook, or
Yeah,
is that?
very exciting development for those of us who are involved in any way in healthcare in Tillamook County. That the Tillamook May Community College is really stepping out smartly with a nursing program that is just so important to creating the workforce, the medical workforce that is needed for facilities like the ones that we operate here in North County. But it's also important for hospitals and the county health clinics and other healthcare providers in the community to have a local source of that kind of talent. So couldn't be happier that the Tillamook Bay Community College has embarked upon that effort, and they have our wholehearted support as they move forward.
I'm guessing you're going to probably be hiring from their cohort very soon.
Boy, I'm sure we will try. There's going to be a great demand. I know on the
Yes,
people that
that's
are
true.
going to be graduating, but we're going to try to get close to the top of the line for sure.
Wonderful. Well, is there anything else you would like to leave the audience with in the last minute or so here?
Well, just thanks for the opportunity to talk about what we're doing in the community and express
Absolutely.
my appreciation on behalf of our board for the level of public support we've received. We're going to need that interest and support to continue, obviously, and we're looking forward to showing the results of what people entrusted us to do when they voted to give us the resources to move forward. So happy holiday season. Merry Christmas to everybody. And it's great to talk to you.
Thank you so much. This has been the Tillamook County Pioneer Get to Know Your Local Nonprofit with Marc Johnson of it's North County Health District or Nehalem
Nehalem
Bay.
Bay.
Nehalem Bay, yes. Thank you. With our second season, and I believe this is going to be the third podcast, depending on which order I decide to put the videos up in, not necessarily the order they're recorded in. And hopefully, we'll have several more of these. And we are actually seeking business sponsorships. So if you want some space somewhere in this podcast and to advertise something that you do locally, please get in touch. Thank you so much.